Welcome to the ABC&Ds of Medicare, brought to you by HealthFocus Partners, an independent, multi-state insurance agency educating beneficiaries of all types about their healthcare coverage. Whether you're experienced with Medicare or learning about Medicare for the first time, this video will explain all the parts, their differences, and what they cover. Jumping right into it, Original Medicare is the insurance provided by the federal government for individuals 65 years or older, or individuals with certain conditions, or collecting Social Security disability for 24 months. Now, it's broken into two parts. Part A, hospital insurance, and Part B, medical insurance. For simplicity, think of Part A as what's being used at an inpatient facility, like, you may have guessed it, a hospital. And Part B covers outpatient services, like your doctor's appointments and medical supplies. For most, Part A is premium free, meaning you pay nothing. However, Part B has a premium that can change annually and is typically taken directly from your Social Security check. This premium will always need to be paid, even if you choose to replace your Medicare coverage. More to come on that in a moment. So Original Medicare isn't completely free, but there's no cost when services are performed, right? Well, no actually. Medicare Part A and B still have deductibles, co-payments, and or co-insurances depending on the healthcare services being rendered, and there's no maximum amount that can be spent. We call these the gaps or holes in Medicare. This leaves individuals who only have Original Medicare vulnerable to out-of-pocket expenses. There's also things Original Medicare just doesn't cover. One of those is prescription drugs. So individuals in Medicare will want to consider a prescription drug plan, aka Part D. These plans are held with private insurance carriers and will include premiums, deductibles, co-payments, and co-insurances. And all plans are not made the same. Some may cover certain drugs where others do not. In addition to having a Part D plan, Medicare beneficiaries with Part A and Part B will consider purchasing a separate Medicare supplement plan, aka Medigap, because they fill in the gaps of Original Medicare. Clever naming, right? This means they help cover the cost of Part A and Part B's deductibles, co-payments, and or co-insurances. There are a variety of Medigap plans, which we discuss in more detail in other videos. Medigap plans are represented by letters like Plan A or Plan D, but don't confuse this with Part A or Part D. So Medicare Supplement does just what it's called, supplements your cost of Original Medicare, but doesn't add coverage to Original Medicare. And we already know prescriptions are not covered under Original Medicare, but neither is dental, vision, or hearing services. So far we have Part A, Part B, Medicare supplement plans that help with the cost of Medicare, and we have Part D. But what about Part C? Part C is referred to as Medicare Advantage plans, which replaces your Original Medicare coverage. Medicare Advantage is managed care from a private health insurance carrier who holds a contract with Medicare. You may be subject to the plan's network of hospitals and doctors. Part C must offer the same services as Part A and Part B, but they are capable of setting their own costs for when services are rendered. They can also add in services not covered by Original Medicare, like your prescription drugs, dental, vision, and hearing. So think of Part C as A plus B plus D, but managed care with an insurance carrier. In short, Medicare has different parts. Original Medicare, which is Part A and Part B, Medicare Supplement, which helps with the cost of Original Medicare, Part D, which covers prescriptions, and Part C, which covers your Part A, B, and D, but with a private insurance carrier. Deciding between keeping Original Medicare and purchasing a Medicare supplement plan and a Part D plan, or replacing Original Medicare with a Part C plan can be a difficult decision. So check out our other videos exploring the pros and cons of each avenue. If you're not currently working with an insurance agent for your Medicare coverage, feel free to reach out to HealthFocus Partners, and we'd be happy to explore your options with you. Thanks, and see you next time.